Welcome to the Dr. Osborne Zone. I'm here today with Dr. Katiraei. He's a pediatric specialist, and he has a strong background in mold illnesses and mold toxicity with children. And I wanted to pick his brain a little bit today on his experiences, and hopefully he can help enlighten us. And if you've got kids and they're sick or they're struggling, maybe we can shed some light on that. Dr. Katiraei, thanks so much for being here today. I appreciate you.
It's my pleasure to be here, and thank you for bringing this entire educational series and film together, because we need a lot more awareness and a lot more information out there about mold. So thank you for the work that you're doing.
Can you tell us, how did you get interested in mold? It's such an esoteric topic in medicine, and nobody's really covering it. So walk us down that line.
Yeah, I think mold was one of those walls that I just kind of slammed into. And, I had quite a few patients that I just could not make heads or tails of. They had all kinds of weird issues, and most of them were the pans and pandas, kids with lots of intense inflammation, aggression, and like high anxiety. Also kids with learning disabilities, a handful of kids with autism that just every single trick that I had in my bag just did nothing for them. And, I was just stuck scratching my head, like, what is up with these kids? Like, why do they have these issues? And there was actually a mom of one of these kids who was just this powerful warrior mom that, started digging and doing research. And she was the one that found Dr. Nathan and, connected with him and said, "Hey, I've set up a consult with this guy, Dr. Nathan. He happens to know a bit about mold. You want to talk to him with me?" I'm like, why not? I haven't been able to contribute anything to your kid's success. Let's see if Dr. Nathan has. And Dr. Nathan was the one that opened my eyes. And we presented a case to him of this poor child with extreme aggression and irritability, got kicked out of school, like brilliant kid, lovely kid, but just could not regulate himself, for his life. And Dr. Nathan looked at his labs, and, I had questioned, like, God, I don't think this is mold. Like, everything looks pretty good. And then Nathan heard the case, looked at the labs, he's like, "Oh, this is mold. For sure, this is mold." And, we dug into it, and long and behold, they had so much mold in their house that literally a mom just left everything, took a handful of clothing and just left the furniture, because it was so contaminated that they just literally were told, like, do not touch anything in this house, just get out. That's what opened my eyes. And early on, so this is like 4 or 5 years ago, my first instinct was, well, oh, wow, this is a problem. Let me find some other person in pediatrics that really understands this stuff, and I'll just use them. And I started looking, and initially was like, okay, let's see if I can find someone in Los Angeles where we're based. And there was no one. Then it's like, oh, how about someone in California? No one. And I started looking, and there were at that time maybe 4 or 5 people in the country that really understood mold. So initially, with a bit of reluctance, I started getting into it and learning from Dr. Nathan, joined his mentorship program, and one thing led to another. And, the more I researched mold and the more I learned about it, and, at a certain point, like obsessively, I was just pulling every article I could find. The more I learned, the more concerned I became. And it just brought me to a place where, literally I was like, oh my God, how much harm is caused to these children and families as a result of mold. And I know why you're here and why all these families are here to listen to this. But as a pediatrician, it's absolutely the most terrifying thing I've ever encountered. And, I've in the past been worried about heavy metals and all kinds of other things. And it's not to dismiss the possibility of those causing harm, but mold to me is the elephant in the room. And it is causing more problems to more children than we can probably wrap our heads around.
That's a pretty big statement. I'd like you to just give me your opinion on the scope of, in your opinion, I know we can't draw, the overarching exact numbers, but as far as kids are concerned, I know autism rates are on on the rise. Pans and pandas rates are on the rise. How much of this do you think is mold? Like, how much would you like guess at, or intelligently say, okay, mold contributes to X%, or can you elaborate a little bit on that?
Yeah. So, I mean, just to reemphasize what you said, we don't know. So we honestly don't have the answer. I can tell you based on my clinical experience and what my mentors have pointed out to me, which I have confirmed in my own practice, is probably, if not close to 50%, upwards or more than 50% of autism may actually be mold toxicity. I can tell you the vast majority of children in my practice that present with PANS and PANDAS ultimately have mold toxicity as the primary factor. So to elaborate on that, right now with PANS and PANDAS, we say, well, strep, mycoplasma, viruses, et cetera, are the trigger for the autoimmune phenomenon. What very few people talk about is why in God's good earth would the child's immune system become so irrational and so incompetent in its response to then start having a reaction to these very, very common things. Like if you check kids for mycoplasma, literally everyone has mycoplasma. If you check kids for CMV, EBV, like at a certain age, most kids have had these viruses. Like these are very common infectious factors that are out there. 20-30% of kids are colonized, like normally colonized with strep, and you don't even know it. So it was actually Dr. Aristo Vojdani. I don't know if you know him.
Yeah.
Who's this brilliant immunologist and one of my mentors that early on is like, Pejman, pay a little bit more attention to the immune system that's reacting to these things rather than things themselves. And as I started really looking at this, like molds, and then you add to, other environmental toxins, is the perfect trigger to cause an immune disorientation where essentially you have loss of tolerance, right? And if you look at what happens with mycotoxins and allergies and all kinds of other things, it causes immune intolerance. And then you add to that the immune suppression and immune disability, essentially, that mycotoxins can cause. All of a sudden, manifestations like PANS and PANDAS makes a whole lot more sense. In my experience, the vast majority of severe ADHD, like those poor kids that cannot focus for the life of them, it's this all the time, weird learning disabilities, severe executive functioning disabilities where these kids just can't like actually start a task, changes in short-term memory, which we all kind of attribute to, this garbage can diagnosis of ADHD. A lot of those kids have mold as their underlying factor. And I mean, the list can go on, but like those high level, things that we pay attention to in pediatrics, a very large number of them are most likely attributed to mold.